Thought this would be a great case to review together. This has been something that's helped me out a lot with TMD patients, specifically patients in pain that need treatment, but they're having a hard time just in general with their TMD type symptoms. So when you look here, you may be wondering, like, what am I even seeing? You can kind of see here that the bite looks kind of funny, and I want to show you. So this is where this patient started. Right, so you can see a little bit of a deep bite, constricted envelope function, some of the wear that you see on the lower anterior is associated with that, and pretty severe TMD pain, inflammation, and sometimes locking, clicking, all the symptoms that you will typically see. And so once, ruling out any sort of overt jaw pathology, any superactive resorption, anything like that, once we kind of rule out, get to the point where we know she can undergo treatment, then this is how we approach this. And this was an approach that I learned from Dr. Brandon Owen from KL Owen, and they make the KL Owen tripod splints, which I'll also use in different situations. But these allow us to get the patient comfortable and essentially kind of deprogram the bite and treat at the same time, for lack of a better description. So the way that we do this is before we scan the teeth, we'll actually add these flat plane bite splints onto the patient's teeth. Sometimes we'll do the upper 4s and 7s like you see here. Other times it'll be like the lower 7s and 4s. We try to get right and left, front and back stops. And then we'll grind those down to make basically a flat plane occlusion essentially. Avoiding any major undercuts so that the aligners will still fit. And then once we get to this point, then we want to make sure that we instruct the text to set this case up properly. So, and there's other videos on that and how to do the pre-setup, so you can check those out. But basically, we'll go into the guided setup and we'll move the teeth and the bite to where it needs to be, ignoring those bite splints. So during treatment, we're going to be reducing those as the patient deprograms. And so in the setup, we're going to ignore those. And so if you look at the setup independently at the movements of the teeth within the jaw, this is your typical deep bite correction type setup. Although when you look from the start to the finish, you'll see there's a bite shift that accounts for the majority of the correction there, and that's because I don't want to treat this case as if it's an open bite, because it's not really an open bite. The material we use is from Dentorum. I'm sure there's other good ones out there. I was introduced to this by actually Dr. Ilya Lipkin. He uses that a lot in some of the procedures that he does. But it comes in a bigger tube, and the working properties are very, very conducive to being able to create ramps like this. And the material is softer than your typical, like softer than band lock. It's definitely softer than flowable or packable composite. And so it's firm enough that the patient doesn't feel like they're squishy. If you have a huge bruxer or somebody that just generates a ton of force, it may not be strong enough. But for most patients, it suffices. And as they chew, it actually kind of self-levels and wears itself down to a certain extent in a good way. So less adjusting is required as the patient's deprogramming, because they'll essentially in some ways kind of deprogram themselves, and the splint will kind of wear more on the teeth that are in heavier occlusion, and it kind of balances itself out to some degree. There's still adjustments required. I'll typically see them the first 3 weeks, and then every 6 weeks or so after that is needed to adjust them until their bite's comfortable and they're not complaining of any pain or symptoms. And so, once we get to the end of this set, hopefully by this time the teeth are, the bumps are ground down, or we've been able to grind them down and keep the patient comfortable. And then we can rescan the teeth at the exact bite where that is and finish them up. Or if the bite is good in the mouth and we can finish with chairside refinements, then we'll go about it that way, and there's other videos on that. But hopefully that's helpful. It's definitely been a huge help in my practice. I've been super impressed with how comfortable something so simple gets patients relatively so quickly. Again, ensuring that you've ruled out any other sort of overt pathology or superactive resorption or something else that's going on that obviously it's not going to treat out so easily. So hope you guys have a great day, and we'll see you soon.